Hi, I'm Lauren with FindMyDentist.com, and today I'm going to talk to you about what dental sealants are, where they're placed, and why they're placed. Dental sealants are a protective coating that can be crafted out of a myriad of materials. Some are referred to as filled, and some are referred to as unfilled. The filled ones can contain materials such as quartz, glass, silica, and other materials that are unlisted. The difference between a filled and an unfilled is that a filled sealant is more resistant to abrasion and it lasts longer because, like dental fillings and restorative materials, sealants often need to be replaced when they're cracked because their function is no longer functional. An unfilled sealant is clear, it's easier to place on the teeth, but it's less resistant to abrasion, which means that you'll have to get an unfilled sealant replaced more often. It's also probably less costly for that reason. Now, a sealant is placed on the posterior or back teeth only, which means the premolars and the molars. To show you what I mean, I'll use this Typodont. The premolars and molars are the posterior teeth, and the reason that sealants are so handy on these teeth is that because they contain little pits and fissures and grooves all throughout their anatomy, so that even if you are the most meticulous brusher and meticulous flosser, you can still have food and bacteria in those places just because they're so fine and so tiny. A sealant is something that will seal off, literally, those pits and fissures and grooves so that there is a surface on top of that, so that when you brush and clean those areas, it's easier to dislodge bacteria because you don't have those little tiny crevices. Sealants can be placed on adults and on children both. Adults, of course, have to pay a fee to receive sealants, whereas with children, a lot of times many programs in the community as well as dental schools will offer sealants either for free or at a discounted rate, depending on what the program is and what their sealant visit appointment entails. Something that's very important to do before a sealant is placed is do a overall checkup of the mouth and make sure that there is no plaque and there's no calculus on the teeth where a sealant will be placed, because that would defeat the purpose of placing the sealant, and then you would eventually have a carious lesion underneath the sealant. A sealant does not completely eradicate the possibility of dental caries, but it does prevent bacteria from building up in those areas, and oftentimes in those pits and fissures, that's where you're going to find a lot of your restoration sites and a lot of watch areas where incipient decay can form and be found on radiographs. A lot of sealants also release fluoride, which is a beneficial ion that is found in drinking water also and can also be offered in treatments. And when the sealants release this fluoride, they make the enamel more strong, more resistant to decay, more calcified, which means that chewing surfaces will be a lot stronger and can withstand a lot more force. Sealants are not necessarily a new technology being used in dentistry, but they are becoming increasingly popular, so it's important to know their uses, why they're valuable, and when they can be placed. I'm Lauren for FindMyDentist.com, and this has been Dental Sealants.